All right, welcome back everyone. Ready to jump into another deep dive? Today we're tackling something I know you all see all the time. Acute low back pain.
A classic, for sure, but always a good one to revisit.
Especially with all the new guidelines and research coming out all the
Yeah,
time.
absolutely. So much to sift through.
Exactly, so that's what we're here for. Today we'll be taking a look at the latest on acute low back pain. Really trying to distill things down to the absolute essentials.
The need to know stuff that'll shift how you approach diagnosis and treatment.
Okay, so first things first, let's define what we're dealing with here. Acute low back pain, that's pain lasting less than 4 weeks, right?
Right. And the interesting thing is, the vast majority of these cases you see in primary care, we're talking over 85%, are non-specific.
Screening.
Meaning there's no clear identifiable cause. It's not a herniated disc or a fracture or anything like that, at least not that we can easily pinpoint.
Which I imagine can be frustrating, both for the patient and the clinician. But the good news is, most of these cases resolve on their own, right? Within a few weeks, usually.
Exactly. The body really is amazing in its ability to heal, even when we don't know exactly what's going on.
Which is a great point to emphasize for patient reassurance.
Absolutely. But, of course, there's a catch.
Oh, there's always a catch.
Right. Well, the catch here is that recurrence is a big issue with low back pain. Some studies show up to 70% of patients experience a recurrence within a year.
Wow, 70%, that's significant.
It is. And then there's the smaller percentage of patients for whom the pain becomes chronic.
Okay, so we've got this picture of a condition that, on the one hand, is mostly self-limiting, but on the other hand, has this potential for complications down the line.
And that really is the challenge for GPs, right? Finding that balance between providing effective care and minimizing the risk of turning an acute issue into a chronic one.
Exactly. So where do we even start? What's the first step in evaluating a patient with acute low back pain?
Well, it might seem obvious, but it all starts with a good history and physical exam.
Couldn't agree more.
Yeah.
We've got to understand the nature of the pain, right? How it started, what makes it better or worse.
And any associated symptoms.
Yeah.
That's key.
Absolutely. And of course, we're on the lookout for any red flags.
Red flags being,
You know, those worrisome symptoms that might suggest something more serious is going on. Unexplained weight loss, fever, bowel or bladder problems, those sorts of things.
exactly. If we see those, further investigation is definitely warranted, imaging, labs, maybe a referral to a specialist.
Okay, but let's say the exam is normal, no red flags. We still don't know the exact cause of the pain. Where do we go from there?
Well, that's where things get interesting, because even though we might not have a precise diagnosis, we can still offer effective treatment and guidance.
And how do we decide which treatment path to take? Do we jump right into medications?
Not necessarily. The current guidelines really emphasize a stepped approach, starting with non-pharmacological therapies.
So putting those prescription pads away for a moment, what are some of those first-line non-drug options we should be considering?
You know, one that often gets overlooked is education and reassurance.
Just explaining things to the patient.
Exactly. Simply taking the time to explain that most cases of acute low back pain get better on their own can be incredibly powerful.
Because a lot of patients come in worried they've got something serious, right?
Absolutely. They might be imagining the worst case scenario, so addressing those fears head on can make a huge difference.
It's amazing how much anxiety we can alleviate just by taking the time to explain things clearly.
It really is. Now, of course, we want to do more than just reassure patients. We also want to address the pain.
Of course. So what are some of the tools in our non-drug toolkit for that?
Well, a good place to start is often superficial heat.
Think heating pads, warm baths, those sorts of things.
Exactly. The idea is to relax those tense muscles, which often contribute to the pain.
And is there evidence to show that heat actually works, or is it more about comfort?
There's actually decent data to support it. Studies have shown that superficial heat can provide modest but noticeable pain relief and improve function, at least in the short term.
Okay, so we've got education, reassurance, and heat. What other non-drug options are on the table? I know a lot of patients ask about massage. Does that have any merit?
It's a bit tricky with massage. It can definitely feel good, and some patients swear by it. But the research on its effectiveness for acute low back pain is a bit mixed. Some studies show small benefits, others don't.
So it might be worth trying if the patient is interested, but we don't want to oversell it as a miracle cure.
Exactly. Now, another one that comes up a lot is acupuncture.
Yeah, that seems to be gaining popularity. Any evidence to support its use for acute low back pain?
Again, the evidence is mixed. Some studies suggest modest pain relief, but others haven't found a significant benefit over sham treatments.
So maybe worth considering if other things haven't helped and a patient is interested, but not necessarily a first-line recommendation.
Right. Now, one more non-drug option we should talk about is spinal manipulation.
Ah, yes, the chiropractor domain. What's the verdict on that one?
Well, spinal manipulation has been studied more extensively, and there's actually some decent evidence to suggest it can provide modest improvements in pain and function, at least in the short term.
But it's not without risks, right? I've heard stories of people experiencing worse pain after manipulation.
That's true. While serious complications are rare, some people do experience temporary soreness or stiffness afterwards.
And I imagine choosing a qualified and experienced practitioner is key.
Absolutely. It's crucial to have a conversation with patients about the potential risks and benefits and make sure they're making an informed decision.
Couldn't agree more. Now, I want to address something I think a lot of patients, and maybe even some clinicians, still believe that bed rest is the answer for acute low back pain. Is that still the prevailing wisdom?
Actually, it's quite the opposite. Bed rest is no longer recommended.
Really? Wow, that's a big shift from what we used to think.
It is. Studies have shown that staying active and moving around as much as you can tolerate actually leads to faster recovery and less pain in the long run.
So we're not talking about bed rest, we're talking about movement.
Exactly. Gentle movements, walking, gradually increasing activity levels. It's all about keeping things moving.
Okay, so we've got a solid foundation of non-drug approaches. Education, reassurance, heat, maybe massage or acupuncture, depending on patient preference, and a careful consideration of spinal manipulation.
It's a good starting point.
It is. But I'm sensing we've only just scratched the surface. What about medications? When do those come into play?
You're right. We've got a whole other avenue to explore there. And while non-drug therapies are the foundation, there are times when medications can be helpful for managing pain and improving function.
All right, I'm ready to delve into the world of pharmaceuticals.
Sounds good.
But for that, we'll have to continue our deep dive in part 2.
So, picking up where we left off, let's dive into medications for acute low back pain. We've established those non-drug approaches are really our foundation.
But of course, there are times when we need a little extra help, to get those patients comfortable and moving again. So when those situations arise, where do we typically start? What's our go-to medication in these acute low back pain cases?
Well, if the pain is still sticking around despite those initial non-drug strategies, or if the patient is really struggling, the guidelines currently recommend a short course of NSAIDs as a good next step.
NSAIDs, right? Those non-steroidal anti-inflammatory drugs,
Hmm.
ibuprofen, naproxen, stuff like that.
Yep, exactly. And the good thing is, most patients are already familiar with these, at least the over-the-counter options.
They are. So what makes them a good choice for acute low back pain specifically?
Well, they tackle the problem from a few different angles. First of all, they reduce inflammation, and we know inflammation is often a big driver of the pain.
Right.
And secondly, they have analgesic effects, meaning they directly block pain signals. So it's like a two-pronged approach.
Makes sense. But NSAIDs, they aren't without their risks, are they?
Oh, absolutely not. We always have to be mindful of those, especially, at higher doses or with prolonged use. They can increase the risk of gastrointestinal issues like ulcers and bleeding.
Right.
And they can also impact kidney function, blood pressure, things like that.
So careful patient selection is crucial. We're thinking about patients with a history of ulcers, maybe kidney disease, heart problems. Those folks might not be the best candidates.
Exactly. Now, another one that comes up often is acetaminophen. I feel like that's recommended for just about every kind of pain under the sun.
It is. So does it have a place in treating acute low back pain?
This is where it gets interesting, actually. Acetaminophen has been used for back pain for ages, but recent research has cast some doubt on its effectiveness, at least for this particular condition.
Really? That is surprising. So are we saying it doesn't work at all for low back pain?
Well, it's not quite that black and white. It might provide some relief for certain individuals, but the data suggests it's often no more effective than a placebo when it comes to acute low back pain.
Ah, interesting. So it's not our top recommendation then?
Right. We certainly wouldn't want to give patients false hope, by saying it's a guaranteed solution or anything like that.
Of course. So are there any situations where we might still consider it for back pain?
There might be instances where NSAIDs just aren't a good option. Maybe the patient has a very high risk of GI bleeding, kidney problems, something like that. In those cases, acetaminophen might be worth considering. But again, we'd want to use it cautiously, lowest effective dose for the shortest duration possible. And always, have that conversation with the patient about the potential risks and benefits.
Absolutely. Shared decision making is so important. Now, what about muscle relaxants? I know those are sometimes prescribed for back pain. Where do those fit in?
Yeah, muscle relaxants, they can be helpful as an add-on therapy, especially if muscle spasms are a big part of the picture. They work by, well, relaxing those tight, painful muscles, which can help ease the discomfort, improve mobility.
Makes sense. So we've got kind of addressing this from all angles,
We are. It's all about tailoring the approach to the individual patient.
right? Figuring out what they need.
Exactly. Not everyone's going to need or benefit from every option. It's really finding the right combination for each person.
I like that. So which muscle relaxants are typically used for acute low back pain? Are there any that stand out as particularly effective?
Well, cyclobenzaprine is often a first choice. Studies have shown that it can provide some short-term relief from pain, and it can help improve function. But of course, like most medications, it does have potential side effects.
And what are some of those common side effects? What do we need to watch out for with cyclobenzaprine?
Drowsiness is a big one. It can make people pretty sleepy. So, timing the dose is important. Taking it at night to minimize daytime drowsiness is often a good strategy.
That's a great practical tip. Now, there's one more class of medications I want to touch on, and I know it's a bit of a sensitive topic, but, it's important to talk about opioids. Where do they fit into the management of acute low back pain these days?
Yeah, this is an area where the guidelines have shifted dramatically in recent years. Opioids are no longer recommended as first line or even routine therapy for acute low back pain.
So are we saying never use opioids for acute low back pain?
It's not quite that black and white. There might be very rare situations where a short course of opioids is considered, but that's only as a last resort and only in very carefully selected patients. We're talking about people who haven't found relief from any other options and for whom the potential benefits clearly outweigh the risks. And those cases are few and far between.
So what's driven this shift away from opioids for acute back pain? There must be good reasons for such a strong stance.
Well, there are several, actually. First and foremost, the evidence just doesn't support their routine use. Studies have shown that they don't provide any significant additional benefit over NSAIDs or other therapies.
So we're not getting more bang for our buck, so to speak, by using opioids.
Exactly. And on top of that, they come with a much higher risk of side effects: sedation, constipation, nausea, and even respiratory depression at higher doses.
Right, right.
And then, of course, there's the ever-present concern about misuse, dependence, the risk of overdose.
It's a powerful reminder, I think, that we always need to weigh the potential benefits of any medication against its potential harms. And with opioids, that risk-benefit ratio just isn't favorable for most cases of acute low back pain.
I agree. It's about choosing the right tool for the job. And in this case, opioids are rarely the right tool.
Okay, so we've covered a lot of ground on medications. NSAIDs are a good first-line option. Acetaminophen, we're being a bit more cautious with that one.
Hmm.
Muscle relaxants can be helpful as an add-on. And opioids, they really have a very limited place.
Very limited.
So what about the bigger picture now? How do we help prevent acute back pain from becoming a chronic problem for our patients?
Ah, yes, the million-dollar question. And that's a crucial one. Now, we can't eliminate the risk of recurrence entirely, of course, but there are things we can do to empower our patients. Give them the tools to protect their backs, help minimize those chances of ending up in a cycle of pain.
Okay, I'm all ears. What are some of those key strategies for preventing chronic back pain?
Well, one that might seem counterintuitive at first is exercise.
Counterintuitive, how so?
Well, because when people's backs hurt, the natural inclination is to rest, avoid movement, But actually staying active and strengthening the core muscles that support the back can make a huge difference in preventing future episodes.
So we're not talking about bed rest. We're talking about getting those muscles moving, building that strength.
Exactly. And it doesn't have to be anything crazy, It's just regular moderate exercise can be really helpful. And of course, there are other lifestyle factors that play a role. Maintaining a healthy weight is essential
Okay.
because excess weight puts extra strain on the spine, making it more vulnerable. And then there's good old-fashioned posture, paying attention to ergonomics at work, using proper lifting techniques, even just being mindful of how we sit and stand throughout the day. All those little things can add up.
They do. They do. It's interesting. It's almost like common sense.
In a way, yeah.
But, it's good to be reminded of these things, especially in our busy lives, right?
Uh,
Easy to let those things slip.
oh, so easy. And they can make a big difference.
So we've got exercise, weight management, good posture. What about stress? We talk about the mind-body connection all the time. So what role does stress play in back pain?
Oh, it's huge. Stress and mental health, they play a significant role in how we experience and manage pain, including back pain.
So what can we do to address that aspect of things?
Well, teaching patients stress management techniques can be really helpful. Deep breathing exercises, mindfulness, progressive muscle relaxation, those sorts of things. And of course, encouraging them to seek support if they're struggling with anxiety or depression is crucial. It's all connected.
It is. It is. Now, I know we've been focusing on preventing acute back pain from becoming chronic, but statistically, a small percentage of those acute cases do transition to chronic pain. So what are some of the red flags that might signal a higher risk of this happening?
That's where our role as astute clinicians comes in. We need to be on the lookout for those factors that can increase the likelihood of chronic pain. And one red flag is what we call maladaptive coping mechanisms.
Maladaptive coping mechanisms. That sounds a bit technical. What does that actually mean in plain English?
Basically, these are unhelpful ways of dealing with pain that can actually make things worse in the long run. And a common example is fear avoidance behavior, where patients become so afraid of pain that they avoid activity altogether.
Which, of course, can lead to deconditioning,
Mhm.
muscle weakness, and ultimately more pain.
Exactly. A vicious cycle. And there are other risk factors we should be aware of, like functional limitations, where even simple daily tasks become difficult or impossible. Poor general health, pre-existing mental health conditions like anxiety or depression, and certain findings on the physical exam that might suggest something more complex is going on.
So we're really looking at the whole patient, right? Their physical health, their mental health, their social situation, their coping mechanisms, it all contributes.
Yeah.
And if we see those red flags, what steps can we take to support these patients? How do we help them avoid that chronic pain trajectory?
Early intervention is key. Referral to a physical therapist or a pain specialist can be incredibly helpful. They can provide targeted exercises, manual therapies, and strategies to manage pain, improve function. And of course, patient education plays a big role. It's
Mhm.
essential to have those open and honest conversations with patients about their condition, the importance of staying active, and the potential benefits of the different treatment options.
It's about empowering them, right? Giving them a sense of control.
Absolutely. And studies have shown that patient education can actually reduce unnecessary visits to the doctor.
So knowledge is power.
I couldn't agree more. When patients understand their condition and have a say in their treatment plan, they're much more likely to stick with it and ultimately have better outcomes.
Okay, so we've covered a lot of ground today. Non-drug approaches, medications, red flags for chronic pain, and this crucial role of patient education. I feel like our listeners are walking away with a really well-stocked toolkit for approaching acute low back pain in their practices. But before we wrap up, I'd love to hear your final thoughts. What's the one thing you really want our listeners to remember?
I think for me, it comes down to remembering that acute low back pain, while common and potentially debilitating, is usually a benign and self-limiting condition.
It is. So our role as GPs is really to provide that reassurance, offer effective symptom relief, and give our patients the guidance they need to navigate their recovery.
Absolutely. And that guidance, it goes beyond just prescribing meds.
It does.
It's about empowering patients to take an active role in their healing process, whether it's staying active, managing stress, or seeking the appropriate support.
It really is about shifting away from that passive model of care where the patient is just waiting for the doctor to fix them,
Right,
and
exactly.
instead embracing this more collaborative approach.
Yeah, where the patient is an active participant.
Exactly. And that shift, it often starts with communication.
It does. Just taking the time to explain things clearly, address any fears or concerns, and involve patients in the decision making.
Because when patients feel heard and understood, that's when we build trust and rapport,
Absolutely.
which ultimately leads to those better outcomes we're all striving for. And speaking of better outcomes, we've touched on this throughout our deep dive, the importance of patient education
It's huge.
in preventing that acute back pain from becoming chronic. So what are some practical ways we can really incorporate effective patient education into our daily practice?
Well, one thing that's simple but powerful is using visual aids. Instead of just telling a patient about proper lifting techniques, for example, show them.
Right. Show, don't tell.
Exactly. Have a model or diagram in your exam room that you can refer to.
Makes it so much more real, so much easier to grasp.
And people, honestly, they often learn better when they can see what you're talking about.
They do. They do.
Yeah.
What other tools or techniques can we use?
Well, shared decision making is another valuable approach. Instead of simply dictating a treatment plan, present the patient with options,
Right.
discuss the pros and cons of each.
Give them a sense of ownership.
Exactly. When they feel more in control of their care, they're more likely to adhere to the plan. And of course, it acknowledges that there isn't always a one-size-fits-all solution.
There isn't. What works best for one patient might not be the right fit for another.
Mhm.
Now, before we wrap things up, I want to touch on one last thing. Earlier we talked about those red flags that might signal a higher risk of developing chronic pain. So are there any specific strategies we can implement in our practice to better identify and support those patients, those who might be at higher risk?
Oh, absolutely. One strategy is to incorporate routine screening tools into our assessments. There are some validated questionnaires out there that can help us identify patients who might be at higher risk, based on things like their level of psychological distress, any fear avoidance beliefs they might have, or functional limitations they're experiencing.
So we're not just relying on our gut feeling, we're using standardized tools.
Right, to make sure we're not missing anything.
It's great. And then once we've identified those higher risk patients, what's next?
Well, then we can tailor our interventions. It might mean more frequent follow-up appointments, early referral to physical therapy or pain management, or even a consult with a mental health professional.
Right, to address any underlying anxiety or depression.
Exactly. It's about being proactive, intervening early.
To try and prevent that cascade of events that can lead to chronic pain. Well, I think we've covered just about everything we set out to do in this deep dive. We've explored the latest guidelines on acute low back pain, from diagnosis and non-drug management, all the way to medication options and the crucial role of patient education. I really hope our listeners are leaving with a renewed sense of confidence.
I hope so too. It's a common problem, but there's so much we can do to help.
There is. And, I think the most important message is one of hope.
Oh, absolutely.
Acute low back pain, while frustrating and often painful, is usually a temporary condition.
It is.
And with the right approach, we can help our patients get back to doing the things they love.
And minimize their chances of long-term suffering.
Couldn't have said it better myself.
Ah.
So to all of our listeners out there, thanks for joining us on the deep dive. Keep those brains curious and keep up the amazing work you do every day. And remember, sometimes the simplest solutions are the most effective. A little education, a dose of reassurance, and a whole lot of encouragement can go a long way in the world of acute low back pain.